Okay, we are live now. Good morning, everyone. Today's session is going to be really helpful and it's led by Dr. Namrata Nagendra from Apollo Cradle and Children's Hospital. She is going to talk about vitamin D deficiency, the risk you might not be aware of. So, stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hi, I'm Dr. Namrata, and today we are going to be talking about a very important topic about vitamin D deficiency. We all know about it already because most of us are already vitamin D deficient. What you need to know why your doctor keeps asking you to do these vitamin D tests. So let's not jump directly into it. Let's just find out some information about it. Um, I'm not able to change the slide. Just give me a second. Just give me a second. Ask.
The slides are visible, ma'am. Hello, can you hear me, ma'am?
Yes, it is visible, but it's not moving ahead.
No, now we have
Nice.
set fixed it. Is it?
Put to the next one.
It's visible now.
The slides are visible, but it's not moving. Can you go on the next page?
Yeah, we are in the third page now.
No, I cannot see that.
Stop using. Present fixed look. Share screen. Windows. Share. Now अभी यहाँ पे करो. Is it visible now? Because it for us it is showing that stop sharing means it's visible.
Are you changing the slides?
Yeah.
No, I cannot see. I can just see the cover page.
Shall we share it to you then? Otherwise,
Yes, please.
yeah. Because for us it is showing like stop sharing. So for us, I don't know what is this now.
Please send it to me.
Yeah.
It's
Visible
moving
now?
ahead.
Okay.
Yeah.
One of you stand.
Yes.
Yeah.
Okay. All right. Can you look? Am I visible in the screen?
Yes, you are visible.
Is it visible? And the
Yes,
doctor is
yes.
also now.
All right. So why do we need to do the vitamin D test? What is vitamin D? We all know that it's a fat soluble vitamin and it is also a hormone. All right. And it exists in two forms. We know that we synthesize it in our skin. So there's a fat layer under the skin which will change it into the first active form, and then it goes to the liver and kidneys to form the second active form. So we know that there are two forms. One is the active form, and the inactive form is the 25 hydroxy vitamin D3, which is the one that we clinically test when we do the vitamin D test. Anything more than 30 is okay, but less than 30 is not great for our body. What can happen when we have vitamin D deficiency? We all know that vitamin D is extremely important for calcium absorption. So you can have osteopenia. Osteopenia means the bones are becoming weak. Porosis. Porosis means there are pores, there are holes that are occurring. Rickets are bones which are becoming crooked. In pregnancy, it can cause low birth weight. So if you would have ideally had a baby which was 3 kgs, you land up with a baby which is 2.2, 2.3 kgs. Preeclampsia is blood pressure in pregnancy. GTM is diabetes in pregnancy. Vitamin D is also an immune modulator, so you can have recurrent pregnancy loss because of that. Because of it, we usually deliver in the ninth month, that is around 37 to 40 weeks, and the delivery can occur before that. There can be neonatal immunity which can be compromised. Now, what are the other functions of vitamin D? It helps, it is a pro inflammatory, so it reduces the amount of, it reduces the immune system against low inflammatory cytokines. That means diseases against arthritis, lupus, multiple sclerosis, inhibits cell growth and angiogenesis when we have deficiency, and it can cause cancers when you are deficient. It can cause diabetes because it would affect the pancreatic B cell. It can also cause deficiency of these can cause cardiovascular diseases and hypertension, stroke. When it is a neuroprotective hormone and can cause dementia, Alzheimer's, and schizophrenia, and musculoskeletal disabilities are known to occur. With many women, when they come to me, they tell me that they have musculoskeletal pain. They don't feel like getting up in the morning. So, who are at risk? Any person who is not getting good dietary intake, who has got no exposure to sunlight, who's homebound, cannot go out, obesity, when the body mass index is more than 30, and you're using lot of sunblocks and overprotecting yourself. Likely benefits of vitamin D supplementation is that the chances of bones being weak, hip fracture, which is one of the most common causes of death in the elderly, can cause this. And in more than 65 years of age, I would want that every woman takes around 800 to 2000 international units per day. For fall prevention, we would want around 800 to 5000 international units per day. I already discussed about some of this. The only thing that we didn't talk about is that it causes respiratory diseases as well. So you can get asthma or chronic pulmonary disease. You can be more at risk of getting tuberculosis, neurological diseases. Vitamin D supplementation can definitely prevent cancer. And we've got two recent studies which show that 50% of patients who had colorectal cancer were vitamin D deficient, and that in cases where higher levels of vitamin D were seen, the mortality, that is the death rate, reduced. We want that every woman gets around 800 international units per day. When we studied them as compared to women who got lesser dose, that is 400 international units per day, the chances of developing breast cancer in the higher group was slightly lesser. But does it reduce the, there was no influence in the recurrence of breast cancer. Now, vitamin D affects the development of neurons and as well helps in the maintenance and survival. Now, we know that these are all the ones that we have told is vitamin D is also very important for your brain health. So, vitamin D, D for dementia, and we know that it is known to cause cognitive malformations and inhibitions like Alzheimer's, chronic pain, multiple sclerosis, Parkinsonism, stroke, seizure, and you may feel restless and you may have sleep disorders. So, who should be screened? Any woman or man who's coming to your OPD saying that they have musculoskeletal pain, who are indoors at high altitudes, do not get adequate exposure, have history of kidney or renal disease, and menopausal, pregnant, and lactating women. We must consider people who are on some drugs, have depression, rheumatoid arthritis, cardiovascular diseases, and chronic fatigue syndrome. I already told that some women who take anti-epileptics can be at higher risk of having vitamin D deficiency. Now, most people would always prefer having dietary sources of vitamin D as compared to taking tablets. So, I have listed out some of the ways where you can increase your vitamin D without taking tablets. So, you can have cod liver oil, you can have fish, you can have egg yolk, and ready to eat cereals. But I would never suggest anyone to have cereals because they are loaded with sugar and preservatives. There is something called as vitamin D toxicity, which can occur when the levels go more than 100 or 150 nanograms per ml. And in these, there can be renal failure and weight loss. But can you get it if you're doing a lot of sunbathing? Very unlikely. Now, what is an interesting fact? Interesting fact is that vitamin D is produced in the skin and it may last twice as longer if you got it directly from your spending time in the sunlight between 7 to 10 a.m. in the Bangalore weather for 45 minutes on bare skin without application of a sunblock. And this is twice as long as what you would get when you took vitamin D through the tablets. Thank you. If anybody has any doubts, I would be happy to clarify them. I see that nobody has any questions. Thank you for giving me an opportunity to speak. Thank you.